Hello, I'm Anastasia, or Anna, and I'm presenting my disease report on Rocky Mountain Spotted Fever. So, this disease is caused by bacterial infection from tick bite, and the bacteria is called Rickettsia rickettsii. It was first discovered in the Rocky Mountains, that's why it has its name, but now it is much more common in the southwestern part of the United States and parts of Canada, Mexico, as well as South and Central America. Cases are most common in the spring and summer when ticks are more active, but in southern areas where it's warmer year-round, you're going to see cases year-round. So 2,000 Americans are affected each year, so it's not a very prevalent disease. And this disease will be abbreviated as RMSF. So moving on to the taxonomy, its kingdom is Pseudomonadata. Its phylum is Pseudomonadata. Its class is Alpha Proteobacteria. Its order is Rickettsiales. Its family is Rickettsiaceae. Genus Rickettsia. Species Rickettsia. So, the characteristics of the bacteria. So, it's coccobacillary, it's an obligate intracellular agent, it's gram-negative, it's not motile. It has an incubation period of 1 to 2 weeks. Once it enters the skin, it's going to spread via the bloodstream and infect endothelial cells and attack the small and medium blood vessels. So once they enter their target cells, they're going to multiply in the cytosol by binary fission. It's going to lead to inflammation, loss of barrier function, as well as a change in vascular permeability all throughout the body. So it's going to cause fever, myalgias, which is muscle cramps and pain, damage to the central nervous system, like headache and confusion, rash and cardiovascular instability, and it's going to downregulate immune pathways so that it can persist longer and cause that fever to be 2 to 3 weeks long. And then one last thing is that in fighting this, the T lymphocyte-mediated immune system mechanisms and cytokines will play a much more important role than antibiotics. Okay, so related diseases. Lyme disease is also caused by tick bite, but there are other less severe and less common forms of rickettsia besides RMSF. So we have Rickettsia barkeri rickettsioses, caused by Rickettsia barkeri. The Pacific Coast tick fever, caused by Rickettsia 364D, as well as Rickettsiopox, caused by Rickettsia akari. Right, so where's this disease at? So despite its name, it's not most common in the Rocky Mountain area. In fact, the 5 states that have 60% of the RMSF infections are North Carolina, Oklahoma, Arkansas, Tennessee, and Missouri, which I do not touch the Rocky Mountains. So it's spread by ticks, obviously, but there's 3 main ones. There's a 4th one on the list called the Lone Star tick. I just included 3 here that are top of the list. So we have the American dog tick, which is going to be eastern part, a little bit Midwest and east. Then we have brown dog tick, which is all over the United States, and then we have the Rocky Mountain, which is in the western, northern Rocky Mountain region. Okay, so how do you know you have it? Symptom schedule. So in early illness, days 1 to 4 after incubation. So fever and headache are the first 2 symptoms you're going to have. And the fever can last for 2 to 3 weeks. You're gonna have GI symptoms like nausea, vomiting, diarrhea, as well as abdominal pain. You're gonna have muscle aches and pains, a rash. This typically occurs 2 to 4 days at the onset, and for some people it doesn't ever happen. And edema is more common in children, and it's that swelling and the blood spots on the skin around the eyes and the back of hands. And then the late illness, which is more severe symptoms you're going to get on day 5 and later. So that's going to be the altered mental status, even a coma, and then there's going to be the attacks on the heart and lungs, which is going to have respiratory compromise, pulmonary edema, acute respiratory distress syndrome, and then the bacteria is going to attack those cells and kill them, which can require amputations, skin grafts, or it can cause gangrene. And then the last symptom would be organ damage to the central nervous system or in failure and incontinence. It can also cause death, but I'll talk about that in a later one. Okay, so diagnosing and treatment. So diagnosis is very tricky because it's so similar to other diseases. So you show up at the doctor's office and you say you have a fever and headache. Well, you could have common flu, you could have a cold, anything. So your doctor's going to want to examine the rash and most likely take a blood test. One thing to note is that 10 to 15% of people with RMSF don't develop a rash at all, so you can't wait for that to diagnose it. With the blood test, you're going to do a PCR test, immunofluorescence antibody assay. But the thing with Rocky Mountain Spotted Fever is that you have to treat before you get the results of the tests, because if you wait for the test results, the disease may progress so much that there's only so much you can do. So you have to treat it before you get the results of the test. So what do you treat it with? Doxycycline, that's an antibiotic. It works well. It's the top one to use. Some people are allergic to it, but you can do rapid desensitization, or you can evaluate the costs and benefits of the allergic response versus untreating disease. Recently there were some complaints about doxycycline causing tooth stains, but I don't think that's an issue when you're choosing between tooth stains or death. And you'll finish treatment with the antibiotic when you're fever-free for 24 hours. So what are bigger complications? So you have damage to small blood vessels. On the image you can see that all those blood vessels up on the surface, as well as gangrene develop in the darker spots. You can have inflammation of the heart, lungs, and brain. Kidney failure. You can require amputation because of all those skin and soft tissue cell death, as well as hearing loss or mental disability. But most people recover in a few days after treatment, and the mortality rate when you treat it is only 3 to 5%, and the mortality rate when it's untreated is 13 to 25%. So prevention. So there's no current vaccine. I found this really interesting because the disease became relevant in the 1920s, and there were vaccines developed for like the next 80-ish years, and they were used like for soldiers going into battle who were like in less clean areas. There's more ticks, there's less medical coverage. So there were vaccines back then, but within the past 20 years there hasn't been any vaccines, so there's no current licensed available vaccine. But once you get the disease once, you will probably not get it again, so that's one reassurance. So prevention is do it yourself. So when you're going out into a place where there's open fields, and possibly ticks, you're going to want to wear long sleeves, tuck the shirt into the pants, tuck the pants into the long socks, wear insect repellent to keep the ticks away. When your pets come in, check them for ticks, because even though you can't get the disease from them and they can't get it from you, you guys can pass ticks between you and get it that way. So also, once you've been out in an area, you're going to want to wash yourself, shower, make sure there's no ticks on you, because the tick has to be on you for 2 hours to be able to infect you, but the longer it stays on you, the more likely it is that you're going to get infected. The longer, keep your lawn trim, rake your leaves, make it unfriendly for ticks. And then tick removal and disposal, you want to remove the tick once you see it on you, and they say that you should not squish the tick, because then it will spread that disease everywhere. And you're going to take it off, put it in a plastic bag, kill it with alcohol, and bring it to the doctor when you go. So, who's at risk? So, people who delay treatment are going to be at risk. Mortality rate is greater for untreated. Children less than 10 years old, people older than 70 are going to be more at risk. And then persons with glucose-6-phosphate dehydrogenase deficiency, that's an enzyme that protects your red blood cells. So when that bacteria is attacking you, you're not as protected. And children represent less than 6% of RMS cases, but they're going to represent 22% of fatalities. So they'll get it less, but they'll die more of it. So, sad. Okay, so it's been a nationally notifiable condition since the 1920s. And the graphs are sometimes confusing because RMSF was on its own for a while, but then 2010 to 2020 it was reported in a group of SFR, so spotted fever rickettsiosis. So this is a graph of SFR. So 2010 to 2020, it includes RMSF, but then after 2020, it's just RSF. So a little confusing. It's hard to find graphs with just it, because I'll have one in the next one. There was a spike in 2017. I wasn't able to find any information on why. And then I saw one article that there's an endemic in Mexican children right now. So, what is planned for the future? Well, in the future, we would like to have better tests so that we can diagnose it and treat it with those tests before we have to decide what to do, so we know what we're treating. Not sure if that's going to be possible. And then education, so educating people on how to prevent it, how you get it, as well as medical professionals, like what's the timeline for it, when you have to have the treatment done. And then perhaps we can start working on another vaccine so that it's more preventable. Okay, so some good news. So this is a graph of MSRF. So it shows the blue dotted line is the fatality rate, and the red line is the incidence of cases per million. So there's not that many cases, but we see that it has been going up in recent years, but the fatality rate is going down. So we're getting more of it, but not dying as much from it. So that is good news. And the other good news is that the only slide left is my sources. So thanks for watching, and talk to you about it on Saturday. Thank you.